But now it's exactly, it's a lot of there'll be more. Yeah, sorry, I think that's testing. Testing. 1, 2, 3. Mic check. 3, 2, 1.
Your shoes are matching. I know.
1, 2, 3.
Yeah.
Testing.
Yeah.
Great.
You got it?
All right. Okay. Hello. Hi.
Hey, Martha.
Nice to see you all. We're going to get you all set up here so that there's a visually appealing background, which is all of your shining faces. So if you are interested in being in this, please let us know and come on up, and we're going to get you all sorted.
I mean, you need like 10.
Oh, yeah, 10 more? How many of you feel new? Vice versa.
What's going on? They said it feels so good.
Great.
Oh, are we done?
Come on. Okay. Let's see.
This is all of us.
Yeah, I'm here to cheer on.
Okay, this is where I'm going to need your help. If you want to come stand back here and just help. All right. Oh, great.
Can I take a photo?
I have everyone like put their hands up like this, and it's gonna be a video, and if you wanna go like, "Ooh," or like, Medicaid saves lives. I don't know which one's up. Medicaid saves lives. Yeah, Medicaid saves lives. All right.
If you want to move
Yes. Okay, so I'm gonna do like, it's like a wave of. Okay, let's do a wave. Yeah, starting over here, and then everyone's gonna go. Medicaid saves Or maybe follow my like slide. So when the camera is near you, everyone please, when the camera is near you, that's when you're going up with your hands, okay? So you guys go back and forth. Still say. The audio is like I started. The audio is at the time. Okay, sorry.
You do this and then we'll all talk to them. Okay.
Are we ready? Yes. So when the phone comes to you, that's when you start
I've
putting
been
your hands
texting
up.
her, so she's already prepared.
But everyone's still gonna say Medicaid saves lives. So I'm gonna audio clip that later. Yeah. Oh yeah. Magic method. Let's do a practice one. That's a good idea.
Yeah, I like that.
We have another human?
Yes.
So we're gonna and great if a page comes.
All right.
Then we'll pull that after.
You guys can say it like, yeah, all right. So I'm gonna go like this, and that means you both start, okay? I know, so much pressure. All right. 1, 2, 3.
By the way, just so you guys are aware, we are live streaming right now. It's not public, it's unlisted, but like reporters could be in it right now. And we'll switch it to public like once it starts.
You can exaggerate a little bit on the line. Yes, I just like say all right, put your little body roll in there. All right. 1, 2, 3. Medicaid saves lives.
Maybe you just want a slow wave. Medicaid saves
All right. Let's go. We gotta go. 1, 2. Yes, Medicaid saves lives. 1, 2, 3. Medicaid saves lives.
All right. Well, thank you all so much for joining us. We are here to raise the alarm as Republicans are now moving heaven and earth to gut healthcare in this country. You know the saying, women and children first? Well, for Republicans, billionaires go first, and women and children go overboard. That is essentially the principle that they are writing into their reconciliation bill right now. Despite all the warning from families across the country, despite warnings from themselves, Republicans are gearing to kick up more than 8.6 million people off their health insurance. And while they are moving heaven and earth to extend tax cuts for the richest people on the planet, they are not so much as lifting a finger to save the health plan tax credits for working families, something that will push yet another 4 million people off their insurance. But it gets worse, much worse. And that's what I want to remind everyone here today now. Because the brutal reality is the Republicans are not just taking away people's health coverage, they also want to shut the doors on one of the biggest healthcare providers in our country. They want to defund Planned Parenthood. That is wildly unpopular. About 3 in 4 people say they oppose defunding Planned Parenthood health centers. But Republicans do not care. They need to appease their far-right, anti-choice fringe. Now, this is going to hurt their own constituents, seeing as 1 in 3 women have been to a Planned Parenthood health center for care. Our Republicans don't care. After all, billionaire tax cuts won't pay for themselves. Although the irony is, in this case, defunding Planned Parenthood would actually cost our country more money in the long term. CBO estimated yesterday that one provision in the House Republicans' bill would actually increase the deficit by $300 million. And defunding Planned Parenthood will cut off millions of patients from basic health care, cancer screenings, pap tests, birth control. But again, Republicans just don't care. Whatever Donald Trump wants comes first. Well, I want everyone to know Democrats do care. And we are not going to let Republicans blow past all the warning signs. Saving people's access to basic health care, saving Planned Parenthood is just too important. We don't have to guess at the stakes here. We already know from experience. We have seen exactly what has happened when Republican states have defunded Planned Parenthood. Healthcare outcomes, worse. Fewer patients receive care. The fact of the matter is, if Republicans get their way, if they succeed in shutting the doors of Planned Parenthood, clinics across the country, millions of women will have nowhere to turn. After all, 2/3 of Planned Parenthood health centers in rural and medically underserved areas, places where there's already a shortage of clinics and healthcare professionals. And for a lot of these patients, Planned Parenthood is literally the only provider in reach and in budget. They literally can't afford to lose this care. So we are not going to stand by as Republicans try to cut off this lifeline just so they can cut a massive check to billionaires like Trump and Elon Musk. We are here today to put a bright and burning spotlight on the full extent of the destruction Republicans are planning, and to lift up the voices Republicans are most afraid of, the patients who they are trying to cut off from healthcare. I'm delighted to be here with several of my colleagues, but first let me turn it over to Alexis McGill Johnson.
Thank you so much, Senator Murray. Good afternoon, everyone, and thank you for joining us. I'm Alexis McGill Johnson. I'm the president and CEO of the Planned Parenthood Action Fund. Behind me are lots of proud Planned Parenthood supporters representing the 19 million supporters nationwide and the more than 2 million patients that Planned Parenthood health centers serve every year. Many thanks to the incomparable Senator Patty Murray, who is a lifelong leader and advocate for sexual and reproductive health care. We couldn't be more grateful to have her, to have Senator Cantwell and Senator Baldwin in the Senate fighting for our communities and for our Planned Parenthood health centers every day. Let me be clear. We are here today because abortion opponents want to slash Medicaid and shut down Planned Parenthood. They are across the street trying to work out a way to sacrifice the health care of millions to give tax breaks to people with billions. Opponents of reproductive freedom in the White House and in the House of Representatives have spent years trying to shut down Planned Parenthood health centers because, where legal, Planned Parenthood health centers provide abortion care. Make no mistake, Planned Parenthood is being targeted. Just like any other healthcare provider, Planned Parenthood health centers get reimbursed by Medicaid for the care that they provide. This is nothing more than an attempt to end abortion in the United States. And they are willing to take away birth control, cancer screenings, STI testing and treatment, and more to do it. Never mind that by law, federal Medicaid funds almost never pay for abortion. Never mind that millions of patients across the country rely on Planned Parenthood health centers for essential, trusted, and affordable health care. And never mind that defunding Planned Parenthood would increase the deficit by $300 million. There is a steep cost to this cruelty. They aren't concerned about patients, their constituents, or cutting costs. They're concerned with pushing an unpopular political agenda and playing politics with your healthcare, no matter the consequences. But let me tell you, they have the wrong ones on the right day. Because this movement has never backed down from a fight, and we certainly are not going to start now. Lawmakers know how popular Planned Parenthood is. That's why some of them are going to spend the next few weeks spreading lies about us. So let me set the record straight. Every year, Planned Parenthood health centers provide essential healthcare services, birth control, pap tests, wellness exams, cancer screenings to more than 2 million patients wide. 1 in 3 women in this country have been to a Planned Parenthood for healthcare, and over half of Planned Parenthood health center patients are covered by Medicaid. If Medicaid patients can't get care at Planned Parenthood health centers, many will have nowhere else to go. No other provider could fill the gap left by Planned Parenthood. So make no mistake, if our opponents get what they want, patients will be denied the dignity of essential health care. They will be denied the dignity of being able to care for themselves and their family. And the dignity, honestly, is what makes us human and equal. So we know that the fight is right now. All of us around here, our people are rising up. We are flooding committee hearings. We are getting loud at town halls. We are jamming their phone lines. We are shouting out in the streets, and we are making their voices heard at every level of government. Movements for the people have always been powered by the people. So we're going to use our collective power to tell our elected officials, don't come for our health care, don't come for Planned Parenthood. There's time to stop this bill. So everybody that you know, get loud, be proud about all of your support for Planned Parenthood, and make sure you're emailing all your members of Congress, you're calling them and telling them to oppose this bill. We can get this done. With that, I will turn it over to Senator Cantwell.
Alexis, and certainly our champion, Senator Murray, for continuing to fight for Planned Parenthood. I can't tell you how many times I've seen her literally go into a meeting room just to tell a bunch of men we're not cutting Planned Parenthood. And here we are again, in an unbelievable moment when the House of Representatives are debating cutting Medicaid in a massive cut that would affect so many people who receive Medicaid benefits. They're going to try to disguise it and dress it up as all sorts of savings somehow for the taxpayer. But Alexis and Patty just said it. It's not even going to save money. It's literally going to cost us more, because instead of giving the care through Medicaid that we have today, you're going to cut people off. So where will they go to receive that care? In a more expensive setting is where they will go. Or they will delay their health care and have a more expensive health care need in the future. So what they don't realize, they're not thinking about, and I guarantee you they are not telling their constituents, is that Planned Parenthood also provides cancer screenings, basic gynecological care, birth control, sexually transmitted infection treatments, and so much more. In the state of Washington, Planned Parenthood serves about 100,000 patients annually. So that just tells you, where are those 100,000 people going to go if you don't have Medicaid as a reimbursement mechanism? About half of those patients rely on Medicaid, and it accounts for about half of the annual budget of Planned Parenthood in Central and Eastern Washington. These clinics and their patients count on that delivery care. And I just want to say a very proud moment for all of those who have fought so hard on this issue for so long, that even when a clinic in Pullman, Washington was bombed, Planned Parenthood showed up the next day and still delivered medication and prescriptions out of the back of a trunk of a car. That's how dedicated Planned Parenthood is to providing care for people. So small communities like that, Pullman, Washington, and other parts of Eastern Washington, where there are no other choices to deliver this kind of care, you're asking people then to either do without care that might tell us something about a very present healthcare condition, or make you have to give up job time or drive miles and miles and miles and miles just to get the care you deserve. So Planned Parenthood and these clinics are part of our healthcare delivery system. Why are we trying to destroy this in rural Washington? I got a letter from Republican county commissioners, Republican state legislators, saying don't make these Medicaid cuts, because they know that it will decimate the whole delivery system in their communities and could mean the closure of 5 to 7 hospitals in the state of Washington. But blocking Medicaid recipients from access to Planned Parenthood will just result in more people losing their ability to have children. I thought we were trying to promote healthy families and getting regular gynecological checkups, but not if they have their way. They want to continue to cut these programs. So blocking these recipients or increasing the rates of HIV or sexually transmitted disease is not what we're for. We're for healthcare, we're for Medicaid playing a part of that, and we're not for cutting Medicaid and giving tax breaks to billionaires and corporations. Again, thank you to Senator Murray and Alexis for organizing this great event.
I also want to thank Senator Murray and Alexis McGill Johnson for bringing us all together today. So I want to thank the folks at Planned Parenthood for all you do to protect Americans' access to essential health care. Because that is what Planned Parenthood does. That is who they are. They are a healthcare provider. They provide thousands of our neighbors, our colleagues, our friends, our family members with essential care at a price that they can afford. And they do it damn well, right? No matter where I travel in Wisconsin, I hear about the dire need to increase access to affordable quality care. In every poll, expanding access to care is an issue that Americans can get behind. And yet here we are again, talking about how Republicans want to take away access to affordable quality care. In every, they are again taking steps to make care more expensive and putting options further out of reach. And let's be clear, we're not talking about abortion today. Although my Republican colleagues continue to sit on their hands while women in 19 states have no or limited access to reproductive freedom. But today we are simply talking about access to basic care, care that Republicans say they support, like birth control and cancer screenings and annual checkups. They aren't just defunding some organizations they don't like or have it out for. They are literally ripping healthcare away and jacking up costs for families. And why are they doing it? Why are they once again putting Americans' healthcare on the chopping block? Well, for starters, we know they don't like women controlling their own bodies, and this follows suit. But also, they are taking away your healthcare so that big corporations and billionaires can get richer. We're talking about giving patients fewer options and pricing them out of care so Republicans can give handouts to the corporations that jack up the costs of prescription drugs and healthcare in the first place. We're here today to make our colleagues own up to what they're doing. If you say you want to bring down the cost of healthcare, why are you siding with big corporations at the expense of Americans' health? If you say you aren't taking away care from patients on Medicaid, why does your plan do just that? These aren't hypothetical questions. I want my colleagues to own up to their plan to take away care for low-income Americans so that the top 1% can get richer. And I'm proud to stand with the folks who are gathered here today to fight back.
Yeah.
We're going to do a quick group photo and then go to QA. If everyone wants to squeeze in on the podium, we'll do a quick group photo with Senator Cantwell.
We have a vote on, she was just being responsible.
And look at me. 1, 2, 3. Great. I'll turn it to Senator Murray for the questions. If there's any reporters. Just state your name and outlet.
Hi, Senator. I'm Oriana with Notice. over in the House, the markup already, they're allowing the defunding Planned Parenthood measure to stay in the reconciliation bill. However, there's a number of GOP moderates that are opposed to it. And so I guess I wanted to get your thoughts, not only on that specifically, but if you see something similar in the Senate, if there are any members, Republican members, that you think are opposed to this measure too.
We are not new to this dynamic. They have tried to take funding away from Planned Parenthood virtually since I got here over 30 years ago. And we know what we have to do. We have to stand up and hold people responsible and let the American public speak out because they overwhelmingly support this. So I expect in the both House and the Senate, there are Republicans who do not want to see this provision in there. We're here to give them the backbone to take it out.
Senator Murray, Paige Cunningham with the Washington Post. I'm sure you recall back in 2017, the last time there was an effort like this, Senators Murkowski and Collins were against it. Had you had conversations with them about their stance now?
I have not. This just got put into the House bill yesterday. I am sure we will have conversations.
And a question for Ms. Johnson, if it's okay, do you have, if this does happen, obviously, as you say, this would mean a lot less funding for Planned Parenthood. Do you have a backup plan to replace that funding?
Look, our local affiliates are having conversations with their governors around backfilling, where they can, but we all know that our states are under a lot of pressure and there is no way to backfill $700 million worth of reimbursements for services provided. Medicaid already is not operating at the highest level of reimbursement equity for the services that are provided. So it will be a significant challenge and the people who will lose will be the patients on the ground.
Hi, Grace Panna with the 19. Thank you for doing this. Also back in 2017, the provision trying to defund Planned Parenthood didn't pass scrutiny under the Byrd rule. Do you anticipate that might be the case again? Do you think Republican leadership will try to overrule the chair on
Let me
that?
just say, we will fight this any way we need to.
Sorry, just one more question. Your opponents have, I know your annual report came out on Monday, and a lot of your opponents have been stressing that other non-abortion services such as contraception, cancer screenings, they say those things are down. I'm wondering if you could respond to those criticisms if you compare to past years.
Look, we're facing a public health crisis across the board, as the other senators noted, right? That particularly since the Dobbs decision, everything that has happened throughout the South, throughout this country, in the Midwest and rural areas where there is such a limited ability for people to get care already, means that, coming out of a pandemic and coming out of a major Supreme Court decision that has taken rights away has also impacted our ability to provide care. This will be yet, a Medicaid defund will be yet another thing that will impact that care. But I can tell you that our providers are showing up every single day to open up those doors and ensure that they are there, and that's what this fight is about.
So you're saying those are down because some clinics have closed in the wake of Dobbs?
I'm saying that it is down because both the clinics through COVID and the other ways in which we are trying to serve and help healthy communities, as we're serving them through telehealth, as we're serving them through other mechanisms, we are hopefully providing as much healthy service to communities as we possibly can.
One more, and I have to go to a vote, so.
Perfect. Well, this one's for Johnson, but
Then I will let her do that. Thank you.
Similarly to that question, a lot of anti-abortion advocates use this argument that, while legally, Medicaid, federal funds can't be used in abortion, it is quote unquote impossible to know where the money's actually going. And I wanted to get your response to those claims.
Again, I think these have been the same arguments that have made over and over again. Federal Medicaid dollars do not pay for abortion. We are able to provide access to sexual reproductive health care, STI testing, wellness exams, and all of the things that we cover where we are able to do that with reimbursement that is allocated by federal funds and state funds for those services provided. And we are able to subsidize much of that with our fundraising. That is what makes us a critical part of the public health infrastructure, and it allows us to be able to provide the care that we need to in communities.
All right, we're gonna have to wrap there. Thanks, everyone.